Hey, welcome back to the deep dive. Today we're really getting into a complex topic, hidradenitis suppurativa. You'll often hear it called HS. We've gathered some really powerful stuff here, medical insights from trusted sources like Mayo Clinic and Stat Pearls, but also very personal notes, real experiences from someone actually living with HS day to day. Our goal today, give you the shortcut to really grasping what this often misunderstood condition is all about.
Yeah, and what's really compelling is how these different sources let us see both sides, the clinical details and what it actually feels like to live with HS. We'll cover what it is, definitely tackle some common myths, look at how it's staged or categorized, and then get into treatments, including the newer options and crucially the mental health side of things.
Okay, let's dive right in. So, at its core, hidradenitis suppurativa HS, it's a chronic skin condition, inflammatory. It causes these painful lumps deep under the skin, things like nodules, abscesses. Sometimes they form tunnels under the skin, which doctors call sinus tracts. These can drain pus, then they might heal, but often leave scars. You usually see them where skin rubs together like armpits, the groin area, buttocks, under the breasts. Sometimes it's called acne inversa, which is a bit confusing, right? Because it's not really acne.
Right, it's not typical acne at all. The inversa part just refers to those locations, sort of the reverse of where common acne usually appears. And the key words from, dermatology sources are definitely chronic, meaning long-term, and inflammatory. These aren't just surface blemishes, they're deep, often very painful lesions. They can burst, drain, and the scarring that happens over time can be quite significant, sometimes thick and fibrotic.
Okay, this next part is really important because there are just so many misconceptions out there about HS. First one to knock down, HS is absolutely not caused by poor hygiene. It's not about being unclean, and it's definitely not contagious. You can't catch it.
Exactly. And that ties into the stigma issue, which is huge for patients. The Mayo Clinic is really clear on this. Infections or being unclean do not cause HS. It can't be spread person to person. It seems to start with blocked hair follicles, not germs.
Right. Another big myth that HS is super rare. We used to think that maybe, but now we know it affects roughly 1 to 2% of people in the U.S. That's a lot of people, millions. And data shows it disproportionately affects women and also people of color. Also, while things like obesity or smoking can make HS worse, it's crucial to know people of all body types, smokers and non-smokers, can get it.
Yeah, the smoking link is quite strong in the research. Smokers often have more severe HS, and there's evidence that quitting can actually help reduce flares, which is, hopeful. As for the exact cause, well, honestly, it's not completely understood. Experts think it's likely a mix of things. Those blocked hair follicles we mentioned, probably combined with hormones, maybe a genetic component, and definitely an overactive immune system response. The Mayo Clinic points to the blocked follicles as the starting point, but why they get blocked in the first place? Still a bit of a question mark.
Okay, so when doctors diagnose HS, they often classify its severity using something called the Hurley staging system. It helps guide treatment. It has 3 stages. Let's break those down.
Sure. So Hurley stage 1. This is generally considered early or mild HS. What you typically see are single or maybe a few separate painful bumps, abscesses. But crucially, without those connecting tunnels or much scarring yet, it might just seem like recurring boils at this point. Our source mentioned their first diagnosis back in 2014 was stage 1.
Okay, makes sense. Then there's Hurley stage 2. What changes there?
In stage 2, you start seeing those recurrent abscesses, but now with the formation of sinus, tracks those tunnels under the skin, and also noticeable scarring. The lesions are still somewhat distinct, though. They might be widespread, but they're not all interconnected across one massive area yet.
Got it. And stage 3.
Stage 3 is the most severe form. Here you have widespread lesions that are interconnected, lots of tunnels branching beneath the skin, many abscesses, and often very little normal skin left in the affected area. It covers large zones, and as you can imagine, it's usually the most challenging stage to manage effectively. Our source described a really tough relapse in 2021 where they felt their symptoms looked like stage 3, multiple interconnected tunnels, large areas involved.
Wow. And it's important to remember HS isn't always static, right? It can flare up or calm down. Our source mentioned humidity and heat being personal triggers causing new bumps.
That's a really common experience. And yes, studies do back that up for some people. Exposure to hot, humid weather is linked to HS flares. Triggers can be quite individual.
So, with all that complexity, what does managing HS actually look like? It sounds like there isn't just one magic bullet.
No, definitely not. There's no single cure-all. Treatment really depends on the stage, the specific symptoms, how severe it is. It's very personalized. For milder HS, stage 1, Doctors often start with things like topical antibiotics, creams, or lotions applied to the skin, like clindamycin, or maybe short courses of oral antibiotics like doxycycline to reduce inflammation. Sometimes hormonal therapies are used too.
Right. And for moderate HS, stage 2.
Yeah, for moderate cases, they might use a combination of oral antibiotics, perhaps clindamycin plus rifampin for a period. Hormonal treatments can also play a bigger role here. Things like anti-androgen pills, spironolactone is one example, can help some people, especially women, by targeting hormonal influences.
You mentioned our sources on metformin, 1,000 milligrams a day. That's
Yeah.
typically a diabetes drug, isn't it? How does that fit in?
That's a really interesting point. Yes, it's primarily known for diabetes, but it's being used more and more in HS, even in people without diabetes. The thinking is it helps improve insulin resistance, which can be linked to HS in some people, and it also seems to have some anti-inflammatory effects itself. Our sources, like stat pearls, mention it as an option, sometimes in stage I, or maybe as an add-on therapy in more severe cases.
Okay. So what happens when HS is more severe, stage 3, or if those initial treatments just aren't enough?
That's when we move towards more advanced therapies. And the big players here are the biologics. These are typically injectable medications, and they're much more targeted. They work by blocking specific proteins in the immune system that drive inflammation in HS. The main FDA-approved one for HS is adalimumab. The brand name is Humira, but there are biosimilars now too, like Eufluma, which our source uses. It specifically blocks a protein called TNF-alpha.
TNF-alpha. Okay. And does it work?
Studies show it can be quite effective. Weekly adalimumab injections have been shown to significantly reduce the number and severity of HS lesions for many people with moderate to severe HS. The FDA approved it specifically for cases that haven't responded well to other treatments, and it's approved for teens 12 and up too. Research suggests that weekly dosing, rather than less frequent, seems to be important for getting the best results in HS.
So medication is key. What about surgery? Is that an option?
Yes, definitely. For persistent lesions, like tunnels that just won't heal, surgical procedures can be very helpful. There's something called de-roofing, where they essentially remove the top layer or roof of the sinus tract to allow it to heal from the bottom up. For very extensive disease, sometimes wider excision removing larger areas of affected tissue is necessary. Laser therapy is another tool some dermatologists use to destroy lesions, but it's important to note that even after surgery, doctors usually recommend continuing medical therapy, often biologics, to prevent new lesions from forming elsewhere. Surgery tackles the existing ones, medication helps prevent future ones.
Okay, so summarizing the treatment landscape, we've got topicals, oral antibiotics, maybe hormonal meds, metformin in some cases, the biologic injections like adalimumab or its biosimilars, and then surgical or laser options. And our source's current plan since late 2023, the daily metformin plus weekly Eufluma injections. That sounds like a pretty standard evidence-based approach for controlling flares long-term.
Exactly. It's a combination aimed at controlling the inflammation systemically with the biologic, potentially addressing metabolic factors with metformin, and understanding it's likely a long-term management strategy.
Right. Now, we absolutely have to talk about the impact beyond the physical symptoms.
Yeah.
Living with HS, it sounds incredibly tough emotionally and mentally. The chronic pain, the drainage, the location of the lesions. Our source was really open about feeling depressed, embarrassed, even dreading going out sometimes, worrying about odor or how the scars look.
Yeah, that really resonates with what the research shows. Studies consistently point out that HS can have a profound negative impact on quality of life. It's not just the physical pain, it's the potential for malodor, the visible aspect, leading to feelings of isolation, impacting relationships, work. It's a heavy burden, and statistically, unfortunately, people with HS do have higher rates of anxiety and depression compared to the general population.
That's heartbreaking.
Yeah.
But it's so important for anyone listening who's going through this to know they are absolutely not alone. Help is available. Mental health support is really vital. Therapy, like cognitive behavioral therapy, CBT, can teach coping skills. Support groups are huge. Sometimes medications for depression or anxiety are needed. Interestingly, some antidepressants, like duloxetine, can also help manage chronic pain, so they might be considered if both issues are present.
That really highlights the need for holistic care, looking at the whole person. Beyond formal therapy, our source mentioned finding real comfort and practical tips in a local support group. Things like meditation, journaling, learning to pace activities to manage stress, because stress itself is often a big trigger for HS flares. Simple self-care things, too, like wearing loose, breathable cotton clothing, trying to keep the skin in affected areas dry. Little things can sometimes make a difference during a flare.
And finding that community, knowing others understand. It sounds crucial. Are there specific organizations people can turn to?
Absolutely. There are some fantastic resources out there. The Hidradenitis Suppurativa Foundation, or HSF, is a major one. They have patient resources, educational materials, even a directory to find doctors' experience with HS. They really emphasize support groups. There's also Hope for HS, which has chapters across the U.S. and holds meetings globally. And HS Connect is a large online community, which is great for people who might not have a local group. These places offer a chance to connect with people who just get it. They understand the daily challenges in a way others might not.
That's so valuable. So general strategies would be find a good dermatologist who knows HS, consider therapy or counseling, educate your own support system like family and friends, and maybe tap into those online forums, but carefully.
Right, exactly. Work with your medical team, build your emotional support network, and use online resources wisely. Always double check information and stick to credible sources like the HSF or established medical sites.
Okay, so wrapping up. HS is clearly more common than many realize, and raising awareness is just so important. If you're listening and you, or maybe someone you know, has symptoms like those recurring painful boils or lumps in the typical areas armpits, growing please, see a dermatologist. Don't wait. Getting diagnosed early and starting treatment can potentially prevent years of pain and the condition getting worse. And if you are diagnosed, maybe consider sharing your story when you feel comfortable. Sometimes just hearing one person's experience can give someone else hope.
Yeah, it really makes you think about how we can all play a part. Even simple things like following and sharing reliable HS info online, maybe supporting organizations like the HSF, or just wearing an HS awareness ribbon. It all helps chip away at the stigma and keeps the conversation going. It helps bring HS out of the shadows.
Living with HS is undoubtedly challenging, but the message we're getting from the sources, from the treatments available now, is that it's definitely not hopeless. With modern medicine and strong community support, achieving better control, having a better quality of life, it's really possible. I truly hope our deep dive today has offered some comfort, some useful knowledge for anyone affected by HS. Thank you so much for joining us on this deep dive. Remember, awareness grows when we share what we learn. If you found this helpful, maybe pass it along. Take care, stay informed, and stay strong.